Hey, welcome back to Whiteboard Wednesday. It's Dr. Edwards at Sarasota Vascular. Today we're going to talk about the different types of vascular imaging. One type of imaging that we as vascular surgeons really depend on and have come to really use pretty heavily in our practice is ultrasound. So ultrasound is a non-invasive image. It can be done in the office setting. There's no radiation. There's no contrast, and what we're using is sound waves to make a picture. We can image almost all of the blood vessels in the body with ultrasound, except the blood vessels that are inside what I'll call a bony space. So like the blood vessels in the brain, that might be where a CT scan or an MR scan comes into play. What you can think about here is it's like getting several x-rays done within a second, and then we stack all those x-rays together, and it's like a flip book. CT imaging gives us really high resolution, very fine detail, and it's very helpful for planning surgeries, sometimes on the aorta, sometimes on the legs, on the carotid. It's helpful for understanding when the vascular anatomy starts to get really complex in particular disease states. CT imaging can be really helpful. MR imaging, MRI, sometimes MRA, which is an MR angiogram looking at blood vessels. This is a different type of imaging to view all different parts of the body that does not use radiation. Very, very good for looking at soft tissue. Very, very good for looking at ligaments and joints. It is good for looking at blood vessels, but we don't have the same MR technology available everywhere. So I wouldn't say that it's necessarily, the standard vascular imaging at every place. And then I want to mention angiograms. So angiograms is considered an invasive type of imaging because it involves us going through the blood vessels, placing little catheters in the blood vessels, and injecting dye to take pictures. But by doing angiograms, we can essentially create a roadmap of all your vessels, find any problems that there may be, whether that's a stenosis or an aneurysm, and we can treat it at the same time. So in summary, if you're having vascular imaging, it might involve all of these in an effort to get the initial diagnosis and then using the angiogram to actually perform the surgery. Vascular surgery is exciting because we have all these different tools in our toolbox that we get to use every day. Thanks for tuning into Whiteboard Wednesday. It's Dr. Edwards.